Good morning. In this video, I will show you some simple exercises to perform after knee arthroscopy surgery, which is a routine outpatient procedure. If you would like more information about the operation, I invite you to watch the informational video, the link to which you will find at the end of this presentation. The reason I'm posting this video is clearly related to the importance of performing exercises after surgery, even at home, and not just with a physiotherapist. The exercises must be performed every day because performing them regularly will allow you to recover much faster. This video is in no way intended to replace what your surgeon or physiotherapist will tell you, and to whom I invite you to always turn with confidence. To perform this exercise, simply lie on your bed or sofa with a rolled-up towel under your ankle. Perform slow flexion and extension movements of your ankle, bringing your toes up and down. Do 30 repetitions 3 times a day. Lie down. Place a rolled-up towel under your knee and begin to contract your quadriceps, pushing your knee against the towel. In other words, try to push your knee down until it reaches full extension. Perform this exercise 20 times, 3 times a day. Lie on your bed or sofa. Try to bend your knee by slowly sliding your heel. Then return to the starting position, fully extending your knee. Perform the exercise 10 times, 3 times a day. Lie down and place a pillow or large rolled-up towel under your knee. Straighten your operated knee and return to the starting position. Increase the difficulty of the exercise by holding the position with your leg straight for 5 seconds and performing 10 repetitions twice a day. While sitting or lying down, try to raise your entire operated leg, keeping your foot raised 30 centimeters from the surface. Repeat the exercise at least 10 times and perform it 3 times a day. To increase the difficulty but also the effectiveness, try to hold the raised position for 5 seconds before lowering it. Lie down and begin to bend your operated leg by sliding your heel. Now, lift your knee with both hands and try to bend it as far as possible, bringing your knee toward your buttocks. Reach the maximum flexion possible so that you feel a stretch in the front of your knee. Do 10 repetitions and repeat twice a day. Lie on the edge of the bed with your operated knee unsupported. Try to bring your foot as far back as you can. Do 10 repetitions and repeat the exercise 3 times a day. Try to hold the position and flex for a few seconds before relaxing. For this exercise, sit on the edge of a bed or on a stable, slightly high chair, preferably with armrests. Place the foot of the healthy leg, in this case, the right, in front of the ankle of the operated leg. The foot of the healthy side pushes back and bends the knee. Perform 10 repetitions twice a day. Remain seated on a chair, preferably with armrests, resting the foot of your operated leg and extending your knee, as shown here, using both hands to push down. Try to keep your foot at a 90-degree angle throughout the exercise. Increase your resistance by trying to hold the position for 5 seconds. Perform 10 repetitions twice a day. Now, stand on a stable surface like a chair or piece of furniture. Keep your feet parallel and shoulder-width apart. Begin to bend your legs slightly without letting your knees extend beyond your toes. Increase the difficulty of the exercise by holding the position for 5 seconds. Perform 10 repetitions, at least twice a day. Maintain the position from the previous exercise with your feet about 20 centimeters apart. Shift your weight onto your toes and then lift your heels off the floor. Slowly return to the starting position. Try increasing the difficulty of the exercise by holding the position on your toes for about 5 seconds. Perform 10 repetitions twice a day. Find a stable platform, or better yet, use a step from your stairs at home. Place the entire sole of the foot of your operated leg on the step, then bend your knee, shifting your weight forward. Return to the starting position. Perform 10 repetitions at least twice a day. While standing, lean against a stable surface and bend your operated leg backward. Start from a partial flexion position and extend your leg, trying to straighten the operated knee. Hold this position for 5 to 10 seconds and then relax. During the exercise, you may feel a tightness in the back of your leg, which is perfectly normal. Perform 10 repetitions and repeat twice a day. I'll save the most difficult exercise for last. Stand up straight, using a stable support for balance. Grasp the ankle of your operated knee, bend your knee, and try to bring your heel toward your buttock. Be careful not to bend your torso forward and hold this position for 10 seconds. Gently release your leg. Perform the exercise 10 times in a row and repeat twice a day. If you think this video was helpful, or if you think it could be useful to someone else, please like and subscribe to the channel. Thank you.